In today's video, I'm going to talk about induction of labor. Induction of labor is putting a pregnant woman into labor when she is not ready for either medical reason for the mother or the unborn fetus. And you know what? It is out of control. Out of control. Can you believe it? Listen to this. I know of an office where 2 out of 3 patients are induced. 2 out of 3. Now I want to tell you something. Listen to this phrase. Induction of labor may increase the risk of a cesarean section. So what is wrong with induction of labor? Well, what I want to do today is this. Rather than talking about how to induce labor, what I want to give you is, I want to give you the tools to be able to say no. I want you to say no. No means no. Now I'm going to talk about a very common scenario. Gestational hypertension. That means your blood pressure elevated during the second half of the pregnancy. Now, what to do with that? I often see induction of labor for that reason, gestational hypertension. Current recommendation is this. If a patient meets the criteria for gestational hypertension, 140/90, more than 2 episodes, 4 hours apart, induction is an option between 38 and 39 weeks. 38 and 39 weeks. And guess what I see? I often see patients coming in at 38 weeks rather than 39 weeks. So if I say, Jane, you know what? Based on your blood pressure, 140/90, it hasn't been any higher than that. You don't have any headaches, no visual change, no abdominal pain, especially on the right side, baby's moving, your baby looks great, and you don't have any symptoms. But your blood pressure, your lab looks great, but it's your blood pressure. So you really have gestational hypertension. You don't have preeclampsia, but gestational hypertension. And I think I should induce you. What I want you to say is, no, Chan, if that's all I have, I'm only 38 weeks. Can I wait? Will something happen to me? I say, I'm going to monitor you. I'm going to see every 2-3 days. Okay. Is it possible that I could wait until 39 weeks? Am I more likely to respond to whatever the heck you're going to do with me? Answer is yes. You see, I want you to really establish a clear communication channel. Get educated, get informed. Don't let me scare you. I don't want you to be induced at 38, Jane. Let's wait until 39. Because you know what? You are less likely to have complication from induction. And what I tell patients is that the best induction is if I pick that right time, so that from the time of admission to delivery is about 24 hours. I want to tell you a scary story. I remember seeing a patient, not mine, admitted for induction of labor, soft call, this AMA. I hate that term, advanced maternal age. Anyone over 35 is AMA, inappropriate. Inappropriate in time where so many women are having, when they are ready, well over 35. Anyways, the patient gets admitted, AMA, for induction on Sunday. She gets sectioned on Saturday, 6 days later. And guess what? 6 days, 6 different doctors covering her. Now, because maybe outcome was, regardless of the outcome, who cares about the outcome? Because it's the process. You want to be able to enjoy the process of being pregnant. If you do, at the end, whether vaginal or not, you're going to welcome and enjoy that miracle. But I can't imagine my wife being in the hospital for 6 days, being managed by 6 different doctors, just to be told, you know what? For whatever the reason, you're not responding. You're not responding to anything that we gave by mouth, vaginally. You didn't even respond to that little balloon thing we put in your cervix. And we've been doing this for 6 years. I think you're okay, but I think we should just call it quit. That scenario is not uncommon. What the patient should have done on day number 2, maybe day number 3 is, heck, could I go home? Was this necessary? Could I take a little break? I don't want all these strange doctors coming touching me. What every one of you tell me a different story. Where's my doctor? And come 6th day, get sectioned? I'm sure she's thrilled to have a newborn. She's been waiting for it all of her life. She's been waiting for this baby. And what? C-section. I tell patients that while cesarean section is a safe procedure for many of us who's been doing this for a long time, if I compare cesarean section to vaginal delivery is like me asking you to jump off a stool. Cesarean section is me asking you to jump off a 4-story rooftop. I know what I want to do. I'm going to jump off a stool. What do you want to do? I want you to be able to say no. I want you to be able to feel like, wow, you know what? I have a good communication channel in place with my doctor. Sean is just a few clicks away. I can text him, call him anytime, 24/7. And I feel like I'm in good hands. Are you? If not, you have to be able to say no, particularly when it comes to induction. Make sure it is being done for the right reason at the right time. I want to help you get the care you deserve. If you found today's video helpful, please click here to subscribe, and you can click here to watch more videos. Remember, I'm on your side. I'll see you in the next video.